My name is Alyssa, and I'm a PICU nurse. I've been a PICU nurse for 6 years, but I've been a pediatric critical care nurse for 8 years. My first travel nurse job was about 6 years ago because I knew I wanted to move from New York to San Diego. So I figured, why apply for a job at a hospital that I don't know when I could apply for a temporary job there and get paid more. So that's what I did, and I ended up loving it, so I just kept extending my contract, and then I eventually signed on as staff. And then I decided to do my second travel nurse job right now because the money is really good right now, and I figured, why not? It's a good deal. You definitely make a lot from your hourly because it's way more than what you would make as a staff nurse, and the rent stipend because the rent stipend is way more than I would ever pay for rent. Right now, my rent stipend is $1,800 a week, and I do not pay that much for rent for a month, so I just get to keep the rest of that. There are a lot of travel nursing agencies, and I feel like it's all word of mouth, how you find out which one you want to use, because you'll hear someone say, "Oh, I have a great recruiter, you should talk to them," and your recruiter makes your experience. Your recruiter is the person basically working for you. They're gonna find you a contract, they're gonna make sure you get the days off that you want, and they're gonna try and get as much pay for you as they can. I also am in a Facebook group, a travel nurse network, and you can see a lot of posts talking about different agencies and which ones are better than others. My first contract I used cross-country just because I was moving across country. I was like, this should work, and I liked them too. But a lot of my friends use Aya, so I went with them, and I really like their website. It's really easy for me to search for jobs on my own, and they have a whole team for me. They have my time card specialist, my experience specialist, and then my recruiter, and they just follow up with me a lot. The typical travel nurse contract usually is 13 weeks. But during crisis, like coronavirus, things like that, they were doing some that were 8-week-long contracts. I noticed that most of those 8-week contracts, they did have you working more shifts per week, so it was usually 4 12-hour shifts. And then after your 13-week contract, the typical length, you can extend. Sometimes you can extend 13 weeks, 4 weeks. They're usually pretty flexible if they need you. Pros of travel nursing is really just the flexibility with taking time off. Also, the money is very good when you're a traveler. Sometimes I think staff nurses at hospitals, especially now at this time, have been a little maybe put off by, "Oh, I'm doing the same thing as you. You're making 3 times the amount of money as me. Why wouldn't I just do what you're doing?" So I think that's led a lot of nurses to leave their staff jobs and do a travel contract. My plan now for my current contract is to just end it in the end of June because I want to take a vacation, which is another great thing about travel nursing is you can kind of make a lot of money right now and then take a month off and start a new contract when you're done with whatever you're doing. It's a great way to try out a hospital too. I heard maybe some weird things about the hospital that I'm at right now. So I figured instead of signing a contract on as core staff, I would want to check it out first, make sure I liked it, and then sign on. The cons of travel nursing would be just being comfortable in a new place. Sometimes when I want to complete a task, it takes 3 times as long because I don't know the phone number for something, I don't know where to find something in the supply room, I don't know which doctor to call and how to find their number. So things like that, you definitely need experience before you travel because you need to be comfortable with your own nursing practice because there's certain times where you feel like you're on your own, and you really are. You don't know the people on your unit, they don't know you, so you really need to be comfortable. So 6 years ago when I was a travel nurse, I had 3 days of orientation on the floor with the preceptor, and then also 2 days where we were in the classroom learning the charting system and the policies of the hospital. But my current contract, I had just online modules to complete, and then just one night with a preceptor, and then I was just on my own. Usually you're expected to work 3 12s if you're working on a traditional nursing floor, but there are PACU or outpatient jobs where you could work 4 10s. Usually in a crisis situation, if the hospital's really desperate, you'll be working 4 12s a week. Just depends on the need. You're there to help them, so they're kind of just filling you in wherever you need them, wherever they need you. If you like to work a certain, like 3 on, 1 off, 2 on, you could ask the manager and tell the manager that you want that, but some hospitals are more accommodating than others. And for days off, right now, my limit was 7 days off that I could request in 13 weeks, and that's in my contract. So those are definite, but anything else is kind of a cross your fingers and hope that you can get off. I think there's definitely some changes in the culture of how people treat travel nurses, and it depends on your facility. If your unit is staffed with like half travelers, that might be frustrating for you because that's so many more extra people that are coming up to you every day. Where's this? Who do I call? Etc. But where I am right now, it's a super small unit, so everyone's been really nice. You just have to be really flexible and adaptable as a travel nurse. You're probably not going to get the most awesome patient assignment on the unit. Usually a lot of admits, discharges, busy assignments. You're usually the first to float, so you'll be all over the place and you won't know where anything is, so it's just important that you know how to find stuff yourself. I like to have all the important policies kind of pulled up on my computer so I can just quickly glance at how they do it at that hospital. I would say if you're considering traveling, make sure you have at least 2 years of experience. You don't want to say that you feel comfortable in a place and get there and they give you an assignment that you can't handle because number 1, that's not safe for your patient, and number 2, just don't do that. Make sure you get your experience first before you travel. I think a more laid-back, easygoing person would be good for traveling, but then again, type A personalities, they're good in the ICU anyway, and if you're organized and you have your stuff together, traveling could be good for you too. You just have to be ready to get out of your comfort zone and be in a new place.